Well, good afternoon, everyone. I want to welcome everybody to our first virtual Community Health Choices Town Hall. We're still waiting for one of our panelists, but hopefully he'll be connected by the time I get through some of introductory remarks. But I do want to welcome everyone, and for those of you that have attended our live town halls, we're going to do the best we can to replicate it in a virtual format. This is all going to be, the content is all driven by you and your questions and your comments, and we really appreciate our panel coming together to be here to have this important conversation and get out accurate, important information. We are recording the webinar, and so if you're not comfortable with that, you should disconnect, but I hope you'll stay on. I want to mention, in case some of you aren't familiar with CARIE, we're an advocacy agency. We've remained operational during this COVID pandemic. You can, I'm going to put some contact information into the chat box so you know how to reach us, and I'm going to encourage you to do so. You'll see David Johnson's name. He's providing technical support today for the town hall. He's CARIE's Community Health Choices, or we'll be using the term CHC throughout the town hall as abbreviation, our CHC advocate. So if you ever have any questions or concerns, or you're trying to resolve a problem, please be sure to contact David, and again, the information's in the chat box. So we're going to take a quick poll while I'm moving on with some other housekeeping information, and then I'll move on to introducing our panel. So if you can, while I'm talking, complete the survey, and then David will put up so we can kind of get a sense of who's here with us today. So what I wanted is to say, as I'm mentioning, we're recording, and we're going to post this town hall on our CARIE's CHC webpage. And again, I have that in the chat box for you to access. David, to everyone that registered, so you'll also get a direct link that way. So the format for today, some of you may have participated in our enrollment and redetermination webinar series, so you'll be familiar with this. But how it's going to work, I would like everyone who has either a question or a comment to use the chat box and type in your question or comment. It doesn't have to be complete. And then I will call on two people at a time. One will be asking the question. You'll mute yourself, and the second person will know you're next. So you'll be ready to ask your question. You can ask your question or share your comment with a particular panelist that you can identify, or if you want to say by plan, or you can direct it to the entire panel, and each person then can respond. So it's up to you what your needs are. So again, in terms of comments, you know, also consider sharing I know people are quick to do concerns, and that's really important, but if there's something positive too, you know, please share that. It's always good to know what's working, because we want that to continue as well. And we certainly want to address problems and answer questions during this town hall. I do want to reiterate which went out in the invitation. This town hall is directed to participants, potential participants, their loved ones, and advocates. Certainly providers are welcome to listen, but the questions, if it's related to something more about your business or your business relationship with the CHC plan, we're not going to take time today for those questions. And I think you should know how to connect to your provider hotlines for those types of questions. So again, start using the chat box to start typing in your questions and comments. You can send it to everyone or just to us on the panel. So thank you, David, for sharing the poll results. It looks like we have a number of volunteers. Thank you for your service, and other workers and advocates. So we welcome all. So with that, I'm going to introduce our panel, and after that, we'll start with the questions that are submitted through the chat. So again, please start typing those in so we can get started with our conversation. So today, we really have a great lineup of folks here to speak with you. Kristen Weierman, I'm sorry, from the Office of Long-Term Living is here. She's the executive assistant. And I'm also pleased to mention that Jamie Buchenauer can be here for part of the town hall. And she is the secretary at the Office of Long-Term Living. And I certainly would have included her on the slide. So it's a nice surprise. And thank you so much, Jamie, for taking time out of your busy schedule to be here with us today. We also have Jen Rogers, who is the Director of Long-Term Services and Supports at AmeriHealth Caritas, Community Health Choices, and Keystone First Community Health Choices Plan. For those of you who may be confused by that, Keystone First is it's the same company, but Keystone First in the Southeast Pennsylvania region, and it's known as AmeriHealth Caritas in the rest of the state. We also have Matt Jennings and David Gingrich from UPMC Community Health Choices, and Matt is the Director of Product Development, and David is the Senior Director of Service Coordination over the central region of the state. We have Norris Benz, who is from Pennsylvania Health and Wellness, and he is the Vice President of Legislative and Government Affairs. And we also have Joe DeMayo, who is from representing the Behavioral Health Managed Care Organizations, which is, as many of you know, is separate from Community Health Choices, but a very important service for Community Health Choices participants. And he is the Behavioral Health Coordinator at Community Behavioral Health, which is the behavioral health plan for Philadelphia County. But he has counterparts throughout the state, and I will put those resources into the chat so you'll know how to connect with them. So with that, I'm starting to see some questions come in. I'm going to call on Jessica Hartfield first, and then I'm going to call on Lee Carroll. And as Jessica is getting situated to unmute herself to ask her questions, Jessica is one of CARIE's long-term care ombudsmen, and the ombudsman is another important program available to everyone throughout the state. Philadelphia. It's managed by the Philadelphia Corporation for Aging, and CARIE provides ombudsman services for half of the city and Center in the Park for the other half. But if you need an ombudsman, which is for residents in nursing facilities, personal care homes, adult day living, domiciliary care, they are there to help be your advocate. And if you're not sure how to connect, if you call CARIE, we will get you to your the right ombudsman program. Our last town hall was at Inglis House, which is a facility in Philadelphia. So we really had a great conversation with residents, not only from Inglis House, but also from a number of other facilities in Philadelphia. So Jessica works with a lot of resident council presidents, and she has gotten a few questions from those folks, and she's going to ask on their behalf. So Jessica, can you unmute yourself and pose your questions? Thank you.
Hi, Kathy, can you hear me?
Yes, the floor is yours.
Yeah. Thank you. Thank you for that introduction. And yes, as you said, so the questions that I have are some of the questions that we have heard from residents in long-term care facilities. And so the first question that I have for the panel is regarding service coordination. So the first question is, are service coordinators still required to meet with residents in long-term care facilities such as nursing homes for check-ins despite visitation restrictions in long-term care facilities? And if so, if each of the panelists, this question is directed at each of the panelists, if you can really explain what your process has been, if that requirement is still in place, or if not, kind of what you each of your plans have in place to stay in communication with residents to have some kind of either virtual check-ins, what that process may look like, and how that process works given some of the technical barriers that residents in long-term care facilities may be experiencing in terms of accessing coordinators, either virtually or in person. So
thank you, Jessica. And actually, I realize I made my first mistake. I'm sure that it won't be the last of the town hall. Each panelist was supposed to give introductory remarks before we got to questions. And of course, my brain just completely blanked out on that. So as the panel, perhaps you could give your introductory remarks and then segue into Jessica's first question, and then we'll get back to the rest of her. She has two other questions after this first one, and I apologize. I'm sorry. So,
okay, so I can start by addressing this question from a department perspective and then hand it off to the MCOs. And so, as Kathy mentioned, my name is Kristen Wireman from the Office of Long-Term Living. And I do want to thank CARIE for coordinating this event today. We are happy to be here to hear your perspectives so we can find ways to continue to improve our programs for our stakeholders as we move into the new year. And I'll provide a couple opening remarks here and then address the question. So, I mean, as everyone's aware, it has been quite a year for participants, our providers, and our managed cares, as well as our Commonwealth staff who participate in or in some way support these programs. In January, we implemented the final phase of CHC in the Lehigh Capital, Northeast and Northwest regions of the state. And then shortly after that, we all had to quickly pivot to the demands COVID has placed on our daily lives, as well as program operations and the way we provide services. And this is absolutely still continuing to evolve. And I'm sure we'll discuss a lot of those things and where we're at today as we have the rollout, thankfully, of a new vaccine. But we're also seeing, a surge of cases in the state and how we're responding with our services. So we can definitely talk through those items today and where we may be going. We are also looking forward to upcoming program changes for next year. And one of the most significant changes that we are working on for 2021 will be starting to shift and re-envision our enrollment system. So for any of you who have enrolled in the program, you probably worked with the independent enrollment broker Maximus. And what we are doing through a request for applications that we had issued is really re-envisioning that process to streamline it, make it easier for everyone, and improve the overall experience, as well as get people enrolled into the program faster. So that work will really begin to take off next year, and we really look forward to getting started. So with that, I will just mention before handing it off to the MCOs, when it comes to visitation in the nursing facilities, any staff and who is allowed in a nursing facility at any given time, ultimately both the Department of Human Services and the MCOs are deferring to the Department of Health guidance. They are really the lead in determining who should be going in and out of nursing facilities at any given time, and who is essential, and how any sort of outside visitation is going to work. And with that, I'll hand it over to the MCOs to address really how each of them are adapting due to those restrictions.
Thank you, Kristen. Jen, did you want to go first?
Or Kathy, can you hear me?
We can hear you. Thank you.
Okay, great. Good afternoon, everyone. My name is Jen Rogers. I am the Director of Long-Term Services and Supports with AmeriHealth Caritas CHC, which we're known as outside of the 5-county area that surrounds Philadelphia. And in Philadelphia, Bucks, Montgomery, Delaware, and Chester counties were known as Keystone First CHC. So I oversee our team of service coordinators, housing coordinators, behavioral health coordinators, and employment specialists. And I've been with AmeriHealth Keystone since prior to go live in the Southwest. And I've been at the town halls, Kathy. I remember the last one held at Inglis House, and that feels like a lifetime ago. So thank you for having us today. Thank you for pulling this together, and I'm happy to answer questions as they come in and hopefully provide the audience with the information they're seeking from the MCOs. To answer your question, I think Kristen did a great job. We are following the guidance of the health department regarding visitation in long-term care facilities in the Commonwealth. That said, we do have service coordinators who are, I'm actually quite proud of the work they're doing on both sides of it, with the facility social work teams and the service coordinators that are on our that work for us. They're doing a really great job communicating, supporting, and taking whatever role the nursing facilities need from us to ensure that in these unprecedented times, participants are feeling supported. So that can be as much as connecting and liaisoning between families and folks that are CHC participants living in nursing facilities. This is critically important in not disrupting our nursing home transition efforts, which have continued through COVID and continue today. And also being very mindful to be in constant communication with nursing facilities across the state about their COVID capacity for taking and admitting and discharging participants that we see moving in and out of hospitalizations and home settings to facilities. So that's a very long-winded answer, Jessica, but the work is still being done behind the scenes, even though we aren't in the halls and in participant face-to-face visits with nursing facility folks at this time.
Yeah, thank you, Jennifer. I'd like to follow up with your response. I just wanted to ask more specifically, given the restrictions, are your service coordinators meeting with residents virtually? And are there requirements for how often they need to do those meetings? I know, things are changing so rapidly, and those, the restrictions around visitation have continued to change, and I'm sure you've all had to adapt, but are there specific, requirements for checking in, and are those happening virtually, if not in person?
So that's a great question, and let me follow up. The requirements haven't changed, so we are still conducting outreach to new participants and following the visit cadence of assessments and revisiting goals as outlined in care plans. We're really dependent on phone calls, either directly to the participants themselves or to the facility social work teams or directors of nursing, whoever we can get and know to connect us with the participant. I just want to be mindful that we don't want to get in the way. We understand how critical the work being done daily because of how hard facilities have been hit. So really it's about fostering a collaborative relationship with the between the service coordinator and the facility to fit in where we can to meet our requirements of assessing and reassessing participants, supporting them, making sure their needs are being met and their goals are being progressed where they can be, and leveraging whatever technology we have, whether it be a telephonic visit, telephonic assessments, or Zoom. But predominantly what we've seen is, like I said, in some instances, really creative ways to connect with the facility teams, with our service coordinators, to with the end goal in mind of supporting participants wherever we can. So to summarize, yes, the visits and the requirements still remain in place. Everything's moved telephonically, and we're trying to get creative where we can to work with the facilities to connect with participants.
Thank you. Yes.
Okay, and now we'll move on to Matt and or David from UPMC Community Health Choices.
Thanks, Kathy, and good afternoon, everyone. I'm Matt Jennings. I'm joined by David Gingrich. First of all, I appreciate and want to thank CARIE for hosting these forums. I think this is my third or fourth. Can't remember. It all blurs together after a while. But I mean, I think we make progress through open and honest dialogue, and don't think we can do enough of it. So thank you all on the phone as well for your attention and participation. It has been a challenging year, I think, to say the least, and is with many crises, the most vulnerable experienced an outsized impact. And this includes many of our participants. The pattern of infection during the first wave really highlighted the importance of rebalancing, which is serving more of our participants safely in the community. And it's one of the main goals of CHC. And in my personal opinion, I think the most important. Can't say enough about the efforts of our service coordinators. David will be saying more. They've gotten out to see our participants when it's possible, and they've shifted to telephonic support when it's not. And they've continued to support our participants amidst the global challenges of this health crisis. And one thing I do want to draw attention to is we really focus on the services, but it's really not enough. The pandemic has exacerbated many of the underlying conditions our participants face. And I think the most salient example is the population we serve already struggles with loneliness and depression. Joseph and the folks at CCBH know this very well, at CBH know this very well. And I don't think anyone would say it's easier to be connected these days. So we continue to focus on those issues, the social determinants of health, as they're sometimes called. And that will be a priority for us going forward. We're also going to continue to pursue the goals we share with the department of rebalancing and integration, and want to move towards value-based reimbursement for services. So it's a very high-level view of UPMC and where we're going. And then now to actually answer the question, I'm going to kick it over to David.
Thank you, Matt. And I'm David Garrick. I'm a Senior Director for Long-Term Service and Supports for Clinical Operations for UPMC. And have also been, similar to Jen, with the respective MCO since prior to the implementation in the Southwestern zone. Also similar to what Jen reiterated, that the expectations for connection with participants and checking in on new admissions as well as quarterly and ongoing visits haven't changed. What has changed during this time period is kind of the modality. So previously we'd been doing a lot of in-person visits, but following the guidance from the Department of Health, we have shifted a lot more to those telephonic as well as virtual visits. So we have some very creative service coordinators as well as creative social workers within the nursing facilities that allow some of that visual connection, even though we're not able to be physically connected. And so our frequency, we do meet at least quarterly with all of our nursing facility residents, but oftentimes it's much more frequently than that. And in particular, when there are facilities that have been impacted by COVID outbreaks or participants themselves that may have been impacted by COVID, we're checking in on them every couple of days to make sure that they continue to get the services and supports that they need. And reaching out and offering whatever assistance we might be able to offer to the participant as well as to the facility to help navigate through this very challenging time period.
Thank you. Thank you, Matt and David. And now, Norris, did you want to provide your remarks and response to that question?
Sure. And again, I'm Norris Benz, and the Vice President of Government Relations at PA Health and Wellness. And like my colleagues, I have been with PA Health and Wellness since prior to go live. I actually started in January of 2017, and coming up on my 4th anniversary. And just like to thank CARIE for the opportunity to be here today and for the great work that you do and have done over the years in the community. So I mean, I really don't have much to add. I mean, I think Jen and Matt really addressed most of the currents, like my colleagues. And we follow the Department of Health protocols, and the requirements have not changed in terms of contacting our members that are in nursing facilities. But we have tried to be innovative, and we check in with them by telephone. We check in with them virtually. When we can. We actually had a pilot program where we gave tablets to nursing home residents, and we did that based on not across membership, but we gave it to the members, individuals in the nursing facility, regardless of which CHC plan they belong to. So we're like my colleagues, we're trying to be innovative and trying to make the best out of this situation, and continuing to check in with our members.
Thank you, Norris. And now, Joe, did you want to provide your introductory remarks and provide any response to that first question?
Sure. I'm going to show my face because I wore a shirt and a sweater today. Got out of my sweatpants. Good afternoon, everybody. I want to first thank Kathy and David for inviting me to be a part of this panel. I was at the panel at Inglis House back when we weren't locked down, I guess. CARIE has been a great advocate throughout Community Health Choices and utilize their services. Everyone who's out there, they're just phenomenal in helping individuals, especially our older adults in Philadelphia who are very, very vulnerable at this time. So my name is Joe DeMeo. I'm the Behavioral Health Coordinator for Community Health Choices at CBH. CBH is Community Behavioral Health. We are an arm of the Philadelphia Department of Behavioral Health and Intellectual Disability Services. We are one of 5 behavioral health managed care organizations involved in Community Health Choices. Throughout the state, CBH represents just Philadelphia County because we have the most population, of course, and we service over 700,000 eligible members for Community Health Choices. For community behavioral health, and with Community Health Choices, we added another 100 or so thousand to that population. The other behavioral health managed care organizations involved with Community Health Choices is Magellan. They're in Montgomery, Delaware, and Bucks County. CCBH is Chester County here in this area. And there are two others, Beacon and Perform Care, which are in other areas of the state. So behavioral health managed care organizations coordinate with the managed care organizations. The CC is the CHCs. We provide behavioral health liaison work, clinical care guidance, coordination of care between members. We offer many levels of care for the CHC population. Remember, Community Health Choices is dual eligible, so Medicare is always primary with behavioral health care. However, we are the Medicaid part of the insurance. We are secondary, but there are also a list of services that Medicare does not cover that we will cover. And they are called specialty services or services that are more inclined for this population: mobile mental health, peer services, TCM, which is called targeted case management. Medicaid also covers mobile crisis, as well as programs what we call ACT programs, mobile psych rehabilitation programs as well. So there are a list of programs that we do cover primary, but we also do the secondary payment of Medicare. So inpatient hospitalizations, outpatient as well. So at CBH, we, throughout COVID, all our providers switched to a telehealth. So people can remain safe in their homes and receive therapy through telehealth. Of course, our inpatient units and other residential units are still in operation. And throughout COVID, you know, we need to keep our staff at these providers that, you know, safe as well, because they are the backbone of the network, you know, people working in these facilities. So throughout the COVID, we were able to help with the staff becoming, you know, stress-free and be able to support them in any way. So yes, so telehealth has been the overall way to get services during COVID, but, you know, hopefully things will start opening up again, and during the summer, hopefully, and we'll get back to the way we were. But if you have any questions regarding behavioral health, I can answer them, especially in Philadelphia. But if there's another question that is from out of the county, I could try as best to help you as well.
Thanks, Joe. And I just want to clarify, there are some CHC participants that do not have Medicare, and the services Joe was referring to, they would cover the full package of behavioral health services. So Jessica, before we resume your questions, we had a question in the Q&A from an anonymous attendee that I think we should probably answer before we proceed. And maybe Jamie, if you would like to respond to this. The question is, what is CHC? Or maybe Kristen?
Sorry, Kathy, I couldn't unmute myself.
I didn't know if you maybe stepped away, but thank you for joining us so much. And I think sometimes we take for granted, since we've been so immersed in Community Health Choices or CHC for so long, that there are folks that are new to the term and new to the program. So could you maybe give a description of that?
Absolutely, absolutely. And apologies again, I couldn't get off mute. On all of these different platforms, you never know where the unmute button is. So the question is, what is Community Health Choices, which we like to call CHC? So Community Health Choices is the Medicaid managed care program that includes physical health benefits and long-term services and supports. The program is referred to nationally as a Medicaid or a managed long-term services and supports program. So you may hear it referred to as an MLTSS. So I think the question also asks, who is part of CHC or who is included in the population that CHC covers? So it's individuals who are 21 years of age or older and dually eligible for Medicare and Medicaid, individuals who are 21 years of age or older and eligible for Medicaid because they need a level of care provided by a nursing facility. Those are our straight, we call them straight Medicaid participants. So the care may be provided in the home, community, or nursing facility, and it does not include individuals that are currently enrolled in a LIFE program. So I hope that's a good summary.
I think so, but if the person that posed that question has any follow-up, please put it in the chat or the Q&A again, and we'll make sure we respond. So now, Jessica, we'll go back because I know you have 2 more questions that you received from residents, and did you want to pose your second question?
Thank you so much, Kathy. And thank you to all of the panelists who took time to answer my first question. The second question that I have is just, we've heard different information, and so I think it's good to hear directly from the providers, you know, what cost consumers may have to think about regarding the COVID vaccination. So the question is, will my CHC insurance cover the COVID-19 vaccination costs for me?
So Kathy, I think it would be helpful if I answered this question since there's not a lot of information out there yet. Obviously, the vaccine is just rolling out to some select hospitals in Pennsylvania right now. So I think I'll answer the question if that's helpful. So the short answer is yes, but it depends. So for our dually eligible participants, well, let me back up and say, first of all, during the federal COVID public health emergency, the COVID vaccine is free. So the federal government is covering the cost for everybody during the federal public health emergency. So that's now till at least mid-January. It's free to everybody who gets it. So if you get a free vaccine, there may be an administration cost. And so that's the cost that the doctor charges, usually your insurance, to give you the vaccine. And so that cost is going to be borne by either your Medicare plan or the CHC plan if Medicare does not pick up that cost. So yes, that will be covered by your CHC plan. So once the federal public health emergency ends, at some point in time, we're not sure when that's going to be. Again, Medicare will pay for that COVID vaccine, or the CHC plan will pay for that vaccine.
Thank you.
Thank you. I think that's helpful. Jessica, did you want to ask your third question now?
Yeah, so the final question.
Go to Lee Carroll after Jessica. Thanks again, Jessica.
Yep. The final question is, what if my nursing facility has a policy restricting access to contracted vendors, which we know is still in place, and so can I work with my CHC to get services? So can I work with my service, my community health choice plan to get access to services that may be restricted in person in my facility?
So we would definitely encourage you to work with your CHC plan and your service coordinator in these circumstances. It's really going to be a case-by-case basis depending on what those services are, what the need is for those services. So the CHC plan may be able to help you identify an exception to continue to receive those services based on need while following the Department of Health guidance, or they may be able to identify an alternative service to at least replace that in the meantime if you can't receive those services in person in the nursing facility. So we would encourage you just to talk with your service coordinator about exactly what it is that you're not able to receive right now, really what the need was that it was supporting and what alternatives or options there may be for you.
Thank you, Kristen. Do any of the plans want to add any additional information to that? Okay. Jessica, did you have any follow-up?
No, thank you, everyone who answered the questions. I appreciate the information.
Thank you. And I just want to say, if there are any residents, we know some residents have difficulty using the chat function or unmuting. If you have any questions that you want to ask and weren't able to, please reach out to CARIE or the Ombudsman, and we will get those answers for you. So thank you. So now we're going to move on to Lee Carroll. I think you had a couple of questions, and then while you're unmuting yourself, following Lee Carroll will be Catherine Fodor. So Lee, the floor is yours. Can you unmute yourself? You need to unmute yourself to ask your questions. You should see a button in the bottom left of your box. Do you see something that looks like a microphone that's red in the lower left-hand corner? If you click on that, it should you should be unmuted. David, are you able to unmute Lee Carroll? If not, we'll move on to Catherine Fodor while Lee's trying to experiment how to unmute. Catherine Fodor, are you able to ask your question? The floor is yours.
Yes, can you hear me?
Yes.
Oh, good, okay. Yes, no, I was just asking Kristen to give me some more background on what it is that that organization does and how do people access it?
So which are you, I'm trying to see if I could find your question.
OLT, I'm asking Kristen.
Oh, Kristen, okay. So you want to know more about the Office of Long-Term Living?
Yes, please.
Okay, go ahead, Kristen.
Yeah, absolutely. So as Jamie mentioned, one of the programs that the Office of Long-Term Living oversees is Community HealthChoices. And we also oversee a few other programs. So we have the LIFE program, which is another integrated care program for individuals who are 55 and older, who are dually eligible for Medicare and Medicaid, and they can receive all of their medical services as well as home and community-based services through a LIFE plan if LIFE is available in their region. And we do expect that LIFE will be rolled out to every county in the state by 2023. But right now there are some limitations on where that's available. In addition, we also oversee one legacy waiver that was not rolled in with the rest of the waivers in the Community HealthChoices program, and that is the OBRA waiver. It is very similar to Community HealthChoices waiver in some ways. So it is still a home and community-based waiver, but it is for intermediate care facility level of care. So the level of care requirements are a little bit different for who would receive those home and community-based services, but those are for individuals age 18 and older who need that level of care and that type of service in their home. So we oversee those three programs. And we monitor the managed care organizations as well. So if there are any other questions you have about what we do, just let me know.
Great, thank you.
And just to back step one further for people that might not be familiar. The Office of Long-Term Living is part of the Department of Human Services, which is the agency in Pennsylvania that's responsible for, among many things, but the Medicaid program. And the Office of Long-Term Living is one of different offices within the Department of Human Services, and as Kristen describes, has a lot of responsibilities. So thank you. We're still trying to get Lee to see if she can get unmuted, but I think she is still having some trouble. I think David's trying to communicate with her to see if we can fix that. So I have a couple of anonymous questions that I'd like to ask. And this one I'm going to just state, and this looks like it's for Joe, as written. It says, does CHC help mental clients? Joe?
Yeah, good afternoon. Behavioral health challenges are, of course, taken care of through the Community Health Choices plan. As Kathy stated earlier, and Jamie said, it's a dual eligible program. So Medicare is primary if you have Medicare, and Medicaid is secondary. However, if you do have straight Medicaid, all behavioral health choices, levels of care are available to every member enrolled in Community Health Choices. So those levels of care are from the most intense, which is inpatient hospitalization, to outpatient therapy with a clinician. So there's many other levels of care throughout the system that could assist in any way to help a member who's having behavioral health challenges, as well as substance use disorder. So Community Health Choices is, the members are automatically enrolled into the behavioral health managed care organization, depending on which county you live in. If you live in Philadelphia County, you have Community Behavioral Health. So yes, right, the service coordinator would identify a behavioral health need. The service coordinator reaches out to the managed care organization, and in turns reaches out to the behavioral health. And we get referrals, we can identify a provider for a member or what service they would need.
Thanks. And Joe, I think if you want to also comment, this has been, I think, a hard time on everyone's mental health. Mm-hmm. And I think did you just want to comment if there's a line someone could call if they just feel like, especially with the holidays, that they may be able just to call to get maybe some support, or maybe talk to someone about their options?
Yeah, each county has what we call a warm line for just people just to talk about any stress or challenges they may have. This warm line is answered by either a mental health professional or even peers. So Philadelphia, we have our own warm line that's open 7 days a week, certain hours of the day. However, if it's a behavioral health crisis, there are crisis lines that we have as well. And if you're at home and there's a crisis, 911, of course, would be the ultimate number to call. But we do have a list of all the warm lines throughout each county. So I will try to find that, and I would put it in I guess an email, or maybe if I could find it, I could share my screen with that later. Okay,
or we can send it out to all the registrants after.
Okay.
When we follow up with the event. I think that would be really, really helpful.
Yeah.
I think it's just important because a lot of times, I think a lot of people don't realize that there are various levels of benefits that can help your mental health. So I'm glad you're hear Joe
Yeah, and
talking
also-
about today.
And also, each behavioral health managed care organization has a member service line. Ours at CBH is open 24/7. You'll always speak to a live member. So you could call that number as well, and I'll add that to the list, our number. And you could just talk about any challenge you might have, and they could refer you or can send you to a somebody who can help you. So there are lots of ways to get services and help through this time.
Thank you, Joe. So it looks like hopefully Lee Carroll is unmuted. Did you want to question? I'm
Sure,
sorry
you can-
about the trouble.
No, thanks so much, and just appreciate you all having this panel so much. It actually was not me who asked the question. I think several other people are using the link, my registration link. So I think that was Jeanette's question. Jeanette, are you on the phone? She might also be under Lee Carroll.
Okay, I do see something from, okay, Jeanette, I think
She'll
now.
be logged in.
Okay, thank you for straightening that out. Yeah, we always have, these are free registrations, so, always feel free to register your own, and that way we can get to your questions. Hopefully we'll be doing this again. It looks like Jeanette now is having trouble unmuting. Maybe David, you can try to help her, and I'm going to ask another question.
I got it. Can you hear me?
It? Yes. Go ahead. The floor is yours, Jeanette. Go ahead.
Thanks, guys, for being patient and helping me figure this out. And thanks, Leah, for inviting us. I am a home health care worker, and we've been having trouble with, I don't know whether it's the insurance side or the PPL side or what's going on, but it says I'm not authorized for hours. Would that be like through, I think, the insurance side and the cut-in hours? I know there's a lot of people that say there's cut-in hours. We want to know why, to be honest.
So I can start, and then I'll pass it off to the MCOs for anything they'd like to add. So first, we did put a hold on all assessments and any reductions in services from March 16th until June 26th, while we were all responding and trying to adapt to the early days of the emergency. Once things started to level out in the summer, and we really had a better response process and operations had adapted, MCOs did begin completing those annual reassessments for participants. That is a requirement. Every year we do have to have an annual reassessment for participants, and that is part of the person-centered planning process. Needs change, and it is important to check in with those participants over time to evaluate, are their needs being met? Are there other services that could more appropriately meet those needs? What has changed, and how can that plan be updated? So I do want to make sure everyone understands that is the cornerstone of this process. Really is the person-centered planning process. And in that process, services can be increased, services can be decreased, or both. Some services could be increased, and in alternative, there could be some other services that could be increased or supplement that service that was decreased. So that is probably why you're seeing those decreases at this time. But I would let the MCOs, I think, build on anything they want to add to that.
No, what I'm seeing is I'm not authorized, being her caregiver, my best friend's caregiver, and I'm not authorized for the hours. So I got cut completely, is what it looks like, honestly. And, I waited 6 months to get on this program, and, my best friend's, for her mental health and stuff, she's got a lot of other things to worry about than me getting paid, because, I took 7 months off from, everything else and put her first, because she's dying basically. you know, and she needs the help, and there's nobody else around to help her. And now she's not only worried about her own health, which the insurance companies aren't, like, they always give a hassle, which stresses her out. Well, she gets stressed out over everything, but you know, this is stressing her out too, because, you know, she knows that I have my family, my kids, my life, and now I'm not getting, you know, any pay. So it's definitely not helping her mentally, and her physical situation is not good at all. I mean, she went from partially walking and now she's not walking at all. She can barely get up to go to the bedside commode, and then I had to tell her that my hours are not being accepted. They're being, that says it's unauthorized, like I'm not supposed to be there. And she's freaking out because she thinks I'm going to leave, and I'm like, well, that's not going to happen. However, the situation is dire for her.
Have you spoken with her has she spoken with her service coordinator from her agency?
Yes,
from her
we both have done that. The service coordinator, and I even went one step above her, which I am in contact with her supervisor. So I've contacted them. I've contacted the payment services as well. And they said it's on the insurance company, and the insurance says, well, there might be a mistake between PPL and us and blah, blah, blah. I'm sorry, but you don't understand the stress that it's causing her, let alone me not being able to pay my bills. But that's beside the point. Her condition is much worse than me being stressed about bills, right?
Now, I appreciate what you're saying. Go ahead, Kristen, I'm sorry.
Sorry. So I would absolutely recommend, so there's a couple things that sound like are happening here. It's unclear as to whether or not there's an authorization communication issue between PPL and the MCO, or if that authorization truly was removed intentionally because of an assessment. Regardless, it also sounds like there is a change in her condition, which should indicate that there should be additional supports from the service coordinator to determine what that change in condition may lead to, or if she needs other services. So Jeanette, would you mind, we do have all three MCOs represented here, and I do believe you can send direct chat messages, and I would request, and we'll volunteer the MCOs for you, if you could please reach out to the representative from the MCO on here that she's enrolled with. Maybe we can get you some direct support.
Yeah, hers is UPMC Community Health Choices.
Okay, and maybe
Jeanette, sorry, this is David Garrick, and hello. I decided to stop hiding in my basement and turn on my camera, but you can send that chat directly to me, and we can look into the specifics of the particular case. Because as Kristen indicated, there could be a couple of things. It could be a breakdown in kind of the authorization being sent to PPL from our system, or it could be a change in the assessed amount. But either way, there should have been communication through the service coordinator to you and the participant about those changes. And if you send me the details, I'll make sure to look into it, and we can get it squared away.
I don't know how to get in contact with you specifically, but I don't know how to chat with you specifically. Do I just put, do you
All right, let me just say this, Jeanette, and to everyone else out there. If you contact CARIE, and David Johnson's our CHC advocate, he can help you resolve and get connected to any of our panelists or who you need to get to resolve problems. You can reach him toll free at 1-800-356-3606. It's also earlier I put that in the chat box. Or you can email him at johnson@carie.org. And he can help you or anyone else that are having these types of problems. And again, I think that you're part of what's called the consumer directed model, which is part of Community Health Choices and offered by all the plans. And this is an important program that, again, we can help resolve if you're having, if consumers are having any kind of issues like these. So we appreciate your sharing that situation.
Right.
I'm not.
I mean, I'm
Go
sorry,
ahead.
Go ahead. Well, it's, you know, it's not just one, you know, it's not just me. There's a lot of us that are, you know, wondering why there's huge changes, and it's not just little itty bitty changes. It's like major mundo changes. And this not only distracts from us, you know, having our, you know, giving care to our folks who we love and care for, you know, it makes them upset too, and upsetting them and making them more depressed is not conducive to getting them, you know, better, or keeping them, you know, as good a condition as possible. You know what I'm saying?
Yes, and I appreciate your raising that, and maybe we can go through the different plans, because we too at CARIE and other advocates, now that some of the reassessments are beginning to happen, many through phone, and service hours are being cut. Now, so I'll let each plan respond to that, but I also want to emphasize that whenever a service or service hours are cut, or if someone asks for something that they need, and if the plan, regardless of which plan it is, says no, you should get a letter. And within that letter, there should be the right to appeal. And you should follow those instructions. You can call us if you need explanation, but in every letter, there is a number for free legal services. And you can follow that. You need to follow the timelines, but even if you have a complaint at any time, you can complain anytime. But if you want to keep your services, when they're saying they're going to be cut, you have to follow timelines.
Right, that's the thing. That they didn't even have anything to say about cutting time for me or anything, or we got no notification that I wasn't going to be authorized.
Okay, so we again are focused on the consumer. Your consumer, if her hours were cut, should have gotten a letter. And if not, again, you would need to call us or legal services. But let me let the plans respond to why people may be seeing a lot of service cuts now, and what participants can do about that if they disagree. So why don't we start with Norris, if you don't mind, from Pennsylvania Health and Wellness, and then we'll give each plan a chance to respond. Thank you.
Thanks. Well, I'm going to turn my camera on. I'm excited to get out of my sweatpants today and actually get dressed up. So it's good to see you, Kathy. It's good to see you, Kristen, Jamie, Matt, and it's been a long time. So as Kathy indicated, there could be a variety of reasons why there are service reductions, and I just really want to encourage people. And one reason, as Kristen mentioned, is that there was a freeze on changes or reductions to service plans for 6 months. And so MCOs have been making adjustments to care plans, and sometimes that could involve a reduction. Also, there could be lots of issues that go on with PPL. PPL, sometimes the individuals, the participants will run out of hours, and sometimes there are authorization challenges. So we just really want to encourage people, if they have questions or concerns, to call us, and we'll do our best to try to resolve the issues. I think we do a good job in in resolving concerns with one phone call. And if that doesn't work, you have a variety of appeal rights that should be spelled out in the communications that you receive. But if you have questions or don't understand something, please call our we call it our PC, our program coordinator line, where our customer service individuals, they do a good job in trying to resolve issues. And if you have questions that you want to share with someone else, I'm happy to, Kathy will give you my contact information, happy to reach out and follow up directly if you have another question about PA Health and Wellness. But really just want to encourage you to reach out to us, and we really will try our best to try and resolve your concern.
Thanks, Norris. Before we move on to the other plans, there's, I don't know which Lee Carroll in the chat, but one of them is saying that some of the cuts are being made without reassessments. I can say, and anyone on the panel can correct if I'm wrong, there should never be any cuts without a reassessment. Some of the reassessments are happening over the phone. It's possible that someone may not realize they went through an assessment through a phone or telephone conversation. So that potentially could be, but at any time when you become aware that your service hours are being cut, you can again reach out to CARIE Legal Services directly with the plan. But the services, there's a process required by the Office of Long-Term Living that the plans must follow. And if they're not being followed, there's remedies for that. And again, it puts people through an awful lot of commotion, but this is why we have these kinds of forums and try to get the word out to people that these problems need to be brought to attention and fixed. So Norris, I don't know if you want to comment on
sure.
that before other plans.
Yeah, thanks for the opportunity to comment. So as Kathy said, I mean, there should not be a change to a participant's benefit plan without an assessment. Sometimes what can also happen is we've seen some issues with the mail, and sometimes it takes a long time excuse me, for participants to actually receive their mail, because if we change someone's existing service plan, we would send a notice, and so sometimes there's a delay in the mail. Sometimes people actually don't get their mail. Sometimes they get their mail and sometimes they don't open it. I get a lot of mail, and sometimes I miss stuff that I really should pay attention to, because most of the mail I get really isn't worth reading. But if you are seeing a situation where you think that you had a change in your benefits, with your services without having an assessment, please call us and actually call me, because if that's happening, I really would like to know about it, because as Kathy said, it shouldn't be happening.
Thank you, Norris. So Matt or David, did you want to respond for UPMC?
Certainly, I can respond. This is David again. As Norris indicated, no changes should be occurring without an assessment taking place. So if you're seeing kind of a change happening without that notice, please contact our member services line or our service coordination hub line, because we certainly want to know about that. We're also, as was referenced, we're in the process of, after that pause in assessments during kind of the spring and summer, we're in the process of getting out and are assessing all of our participants for that annual assessment for Community Health Choices. So we are seeing some service plan changes, but in any instance where there is a change, whether it's an added service or a change in services or a decreased service, participants would be getting that notification. Because of, as Norris referenced, some of the issues with mail, we've actually extended our time period a little bit for participants to have additional time to file an appeal or grievance. So because of some of the delays that we've seen, we've extended that time period that will accept appeals for participants and grant that continuity of care during that grievance process. But if participants are running into issues where they're not receiving notices or not certain what is happening with their services, please reach out to us. And we want to make sure that we get into communication with the participants, and our service coordinators can also help in filing that appeal or grievance.
Could you just also add to the first part of the question, why people are starting to see all these cuts in hours?
Well, I think it's because of the delay or the pause that the Office of Long-Term Living had put into place with individuals being assessed between March and June. We're now getting out and assessing participants utilizing the inter-RAI and building service plans. And I think something that is important is I know focus of the question is on some of the reductions, but we're also increasing hours as well as we're getting out and seeing participants' needs, or if there's a change in condition or triggering event. We're getting out there and making modifications, both positive and in some cases reductions to the plan. So it's not, they're not all plans are being reduced. A large number of them are remaining the same, as well as increasing as well.
Thanks, David. Jen, did you want to weigh in?
Sure, Kathy, it takes me a minute to get off mute. I apologize. So I don't think I have a whole lot to add to what Norris and David have already shared with the group. Just to underscore that changes are increases, decreases, or a different suite of services to meet participant needs. And I think that it's worth noting in CHC, having come from the waiver world where attendant care was pass, a direct care worker, and a service coordinator, and a personal emergency response button. So participants that had food insecurity or non-medical transportation needs or wants, or maybe had an interest in attending an adult day program, didn't have access to those services because they were limited to the attendant care waiver. With CHC, we've opened that up. I believe last count are 32 services available to people. And the aim of the program is to use the tools, the assessment tools and the resources and the training that the service coordinators have to understand what the participants' needs are, what their family dynamics are, what is being met informally, what's changed over time. Having worked in LTSS for coming on 20 years now, which is hard for me to say out loud. I used to be a service coordinator. What I can tell you is that is absolutely true about LTSS is that it's not black and white, it's gray, and it changes over time. Circumstances change, age compounds things, different conditions, underlying conditions, comorbidities change the need over time, and CHC was designed to respond to that need through trigger events and assessments, and to use the tools that we have to understand what makes sense, what level of care right now makes sense to maintain independence, not supplant the natural supports that are already in place, and to support the participant where they are in the setting of their choosing. That is everyone's goal here. But I think we also have to acknowledge that those things change over time, and that it's still a participant's right to ask for a reassessment. That is a trigger event. If they don't feel that what is put in place in the home now is working, they have the right to request a new assessment. That's whether you're with AmeriHealth, Keystone, UPMC, or PA Health and Wellness. We are measured on our communication and our grievance process. How are we informing participants when there's a change in their care plan? And are we adhering to our agreement with OLTL with the content and readability of our denial letters, the mail dates, all that stuff that Norris and David already spoke to? So if things are happening that aren't clear or we feel is below board or whatever, we want to hear about that at the plan level so that we can address it. And I just saw a comment pop up that the assessments aren't honest and it's immoral to ask family and friends to perform medical, healthcare, and work for free. So I don't think morality is on the topic, on the discussion today. It's in your family dynamic, who does what and who's willing to do what. And if your son is not comfortable bathing you and you are his mother, right? Then we need to come up with a different course of action that meets that need, because you still need to get a bath every day. And right now where you are in your life, you can't do that yourself. So it's either, okay, a direct care worker that's not related to you, or the son is going to take care of the household needs that you have to maintain your independence. What we know is that it's willing, available, and have capacity. That is what we are looking at and evaluating. We are not forcing family to care for family or to do things informally. We're trying to put a care plan together that makes sense. Who does what to get the needs met and to maintain that person's independence and well-being.
I appreciate hearing that clarification, because I think you raise a lot of important points here, that because someone has, maybe someone in the household or a loved one, doesn't necessarily mean that the participant's either comfortable or that particular caregiver's able to perform important roles in terms of care. So this all needs to be worked out in that conversation with service planning. And if, again, as a participant or someone, the responsible party for the participant does not feel the plan reflects needs, we have to keep pushing forward to try to either appeal or work through some of these issues. But I can see from the chat that there seems to be a lot of serious concerns about this, that I hope we can continue to work to make improvements in this regard. I want to call on, I know Catherine Foder's been waiting quite some time, and then after Catherine, we'll move on to Erica Payne. Is Catherine Foder still with us?
No, I asked my question earlier.
Okay, I'm sorry, I'm losing track.
Thank you.
Thanks, Catherine. Erica Payne, and then Stephanie Williams. Erica, can you unmute?
Yes, I can. Thank you. Hi. Thank you guys so much for pulling this town hall together. It really is helpful. I don't mean to beat a dead horse, but yeah, so I've been seeing a lot of participants losing hours. I have a participant who gets maybe about 40 hours a week, and her primary caregiver passed recently, right before she was going in for reassessment. And she had asked for more hours simply because she has just limited use of her hands. She cannot do anything else for herself. 90% of her stuff has to be done by somebody else. So the coordinator wouldn't even entertain the idea of her getting any more hours, who tried to put all different types of things in place instead of actual person care, which is what she needs. And we're getting an idea that it could be a funding issue that is probably stopping her from increasing her hours. I was just wondering if there was something in there and what you guys need in order for our participants to actually get the services that they need. It's a two-part question, sorry.
So are you asking this of all the plans, or was there a particular plan this was related to?
When I ask what you guys need in order to get everything together, it's for all of our participants, anybody who participates in home care.
Okay, so I guess, Jen, did you want to pick up and start again with this?
Kathy, I don't mean to be dense. I'm just unclear on the question.
Okay, so we have participants straight across the state who are losing hours left and right, and these people are in serious need of somebody actually being there. Specifically, my client who needed to increase hours, and her case coordinator wouldn't even entertain the idea She's quadriplegic, so she needs somebody to do something for her at all times, cook her meals, help her prep to eat her meals, roll her over at night, things like that.
I think just to clarify, it seems like when there's hours that are cut and there seems to be safety issues and the participants not really able to advocate on their own behalf. In this case, the loved one had passed. What's the best way to try to? It seems like there's an urgency, as well as a somewhat of an inability on the part of the participant to try to, get back to a safe situation.
Okay.
Yes.
That's helpful, Kathy. Thank you. So here's what I would say. 2 things. One, in a person-centered program, we need to be mindful that we can't speak in broad terms. Your services and supports in your circumstance are going to look very different than your counterpart elsewhere. So I want to be mindful that we train our service coordinators to approach care and service planning using the mindset of what is important to, what is important for, what's working, what's not working. And that is what should guide the conversation, which is facilitated by the service coordinator. Service coordinators don't deny services. There is a process of review that has to happen in order for changes in the care plan to happen. That review process looks at clinical documentation, the service plan, the comprehensive needs assessment. All 3 plans use the Inter-I home care tool to evaluate what level of care based on your ADLs, activities of daily living, your household composition, your diagnosis, all that good stuff is taken into consideration to make recommendations for service levels and approval or denial of service levels. So that is a process that we're following. You mentioned that in this particular circumstance, I heard a trigger event. When your caregiver or informal support has changed, and I'm sorry that the person you're speaking of lost a loved one, that is something that makes everyone have to go back to the table. And when I say everyone, also built into CHC is the concept of a person-centered planning team. Whereas not just the service coordinator and the participant are having a conversation in a vacuum, but anyone and everyone who the participant wants invited has a seat at the table to discuss, what does this person-centered service plan look like? What services are included and what type, scope, amount, frequency, and duration are going to meet the needs based on their self-reported and assessed needs, right?
Right.
So as a provider, which I think you are, Erica, and if I'm mistaken, I apologize. There's agency there for you too. You said that the participant's not able to advocate on their behalf. So I think a couple things need to be dissected in that particular circumstance. Is it time to start talking about guardianship, power of attorney, someone who can help make financial and health decisions for that participant? Is that appropriate? I don't know. These are just things that are coming off the top of my head, with the goal of, again, maintaining independence and prolonging the participant to reside in a safe setting of their choosing. That is a shared goal, I think, whether you're a provider or a CHC MCO service coordinator or anybody else on that call. We want to see this work for Pennsylvanians, and it works when we have a strong care team. Kathy, you know this, a strong advocacy community in Pennsylvania, and a program, which I think we have in CHC, that embraces the concept of a care team, acknowledges that things change over time and sometimes can change on a dime, and then the tools and resources to meet that need and assess it for what the program can and cannot do for people.
So you're saying to ask for a reassessment.
In that particular instance, Erica, what you described to me is a major life event. The participant who's a quadriplegic lost a family member. That needs to enter into the discussion so that we know what going forward is the right level of service to maintain independence and the living in the setting of that participant's choosing.
Okay.
Jen, before we move on to other panelists to see if they have anything else to add, my understanding is that each plan has like a nurse helpline or something along those lines. If someone's concerned about the safety of a participant, is that an effective resource to use to try to address something like an immediate need that maybe can't wait through this whole reassessment process? Could you comment on that?
Are you asking me to comment, Kathy, on the safety issues?
Yeah, and and also if there is in fact some kind of a nurse hotline, or what hotline at the plan level could someone call if they were really concerned about the safety of or well-being of a particular participant in a, let's say, a life-changing event, as Erica described, that there may be something happening that can't wait for a full assessment to occur.
Sure. So a couple of things there. That feels like a little bit of a slippery slope because there's so many vectors for safety to meet safety needs. Yes, the plans have 24/7 nurse lines. Yes, we have participant helplines. Yes, we have service coordinators on call. Yes, there's an APS and OAPAS system in Pennsylvania. And yes, there's a trigger event process where a change in need or hospitalization or change in living status is a trigger event. And we don't like say, oh, it has to be, we'll get to you in 14 days. No, if an assessment or a reassessment needs to be done quickly, that can be accomplished. Okay. So, and we see this every day with successful discharge planning from either a nursing facility or a hospital, or a changing caregiver. And COVID, I will tell you, has really put that process to test. And I'm very proud of the work that the service coordinators have done to move quickly, to put plans and services into motion to respond to needs that change quickly. So I think there are lots of vehicles. I would start with the service coordinator, especially now we've all moved to telephonic assessments. We can make care and service changes quickly. We're contractually obligated we have timeframes to respond to changes. And again, if a denial occurs, Kathy, it doesn't happen instantaneously. There is a established process that all three plans have to follow for giving notice, appeal rights, grievance rights, and then notification of when the services are going to adjust or change. So it's not that I see you today, we leave the meeting thinking nothing's changing. It goes through the review process, things change, that's communicated to you, and tomorrow it goes into effect. That's not what is outlined in our agreement with OLTL. Excuse me.
You're taking the time reinforcing the processes that are in place, the various variables, because every situation is in fact different, but when there are emergencies or true crises, there are remedies that can be utilized to really address some of these critical problems. Do any of the other plans want to add to Jen's remarks before we move on to Stephanie Williams, then Hilary Rothrock?
Only thing I would add and is that we PA Health and Wellness, we feel our participants can ask for a new assessment at any time. I mean, of course, as Jen mentioned, there are trigger events that require a new assessment. But if at any point you feel that, or the participant feels that their services are not sufficient, they can ask for a new assessment at any time. And we're required to conduct that review as expeditiously as the participant's condition requires. So, I mean, there are means, as you mentioned, Kathy, for when there are safety concerns. But if something is happening and there needs to be a quick evaluation, we're required to do that as quickly as possible. So a lot of things that are in place, and just really want to encourage people to, our participants to reach out to us if you're having trouble with the a response from the service coordinator. Then call our main customer service line and let us know, and we certainly want to know that. And service coordinators, I think Jen said it, so I'm sorry if I'm repeating it, but I think it's worth repeating it if she did. Service coordinators should not be refusing requests for additional services. I mean, service coordinators don't determine what services a participant receives. I mean, we're required to conduct a comprehensive evaluation process. So as I mentioned, if you feel you need more services, we will make an evaluation and determine what we think the participant actually needs. And there will be times, unfortunately, where the participant and sometimes the caregiver disagree with the evaluation that we made. But there is a very comprehensive appeal process that, again, requires that it be resolved in the most expeditious manner. So you can ask for an expedited grievance, you can ask for an expedited fair hearing, and that process all moves quickly if the participant's condition requires it.
Thank you, Norris. Did David or Matt? Oh, go ahead, David. Thank you.
And I would just add, sorry, I anticipated it. I would just add that, I mean, I think Janet and Norris covered it very well, that participants have the ability and right to, at any time, request an assessment, as Norris indicated. And if there's something that was believed missed during the assessment or a change in circumstances that may have occurred, participants have the right to file those grievances or contact the health plan to request an additional assessment. And our service coordinators are also trained, and they reach out. So if an appeal has been filed or a determination has been made, they reach out to participants and help make them aware of the process to file that grievance, and then walk them through the continuity of care process, as well as helping them if they need assistance in filing that grievance with the health plan.
Thank you, David. And I just wanted to mention, this is still, even though this is still a new program. And I think with COVID, just like with everything else, is making everything much more complicated. I know, for example, the telephone assessments are not something anyone would recommend in normal circumstances. You really need those in-person visits to do good assessments, but we are in these challenging times. And I also want to mention the appeals and the different things you get in the mail, and when you're not feeling well and you have a lot of issues, it can be very overwhelming. And that's really why we have a dedicated advocate, and really all of our CARIE line advocates can help you make sense of all this and try to work through these problems. And I encourage you to contact us or call us. And again, I can't emphasize enough, if you get one of those appeal letters, you want to move on it, you want to call legal services, because if you do it in a timely way, you can continue with your services while you're appealing. If you get the letter late, like Norris had mentioned earlier, still call, because there may be exceptions that can be made to timelines given the mail delay. So make that call. So let's move on now to, is Stephanie Williams available, and then Hilary Rothrock. Stephanie, go ahead.
Hi, everyone. I was on yesterday's meeting, and it was pretty enlightening for me because I wasn't aware that so many different changes happened to our consumers as far as needing help, and to find out that their hours were being lessened, it really troubled me, especially the one about the 95-year-old woman. Her hours, for whatever reason, were less, and I just don't understand how can that be. If she's 95, to me, that means she needs round-the-clock care, as well as the gentleman who has chronic seizures around the clock, and his hours.
Stephanie, I'm going to cut you off. I thought you were asking about a person you were familiar with. I'm not familiar with what meeting you're with, but if you have a particular personal situation you wanted to share, please do so. But I think we've been trying to touch on some of those reasons why the hours were cut, and I want to make sure we get to everyone who has questions.
Well, you know, you can just go on ahead and let someone else speak, and I'll just continue to listen.
Okay, did you have a personal, was there a situation you were yourself trying to resolve that you needed help with?
No, I'm just interested in the meetings because, like I said, I wasn't aware that there was so much going on between, you know, client care and, you know, the caregivers with their coordinators or whatever. I didn't know it was so many problems until yesterday.
Okay, thank you, Stephanie. Is Hilary Rothrock with us?
Yeah, hi, I'm here. Can you hear me?
Go ahead.
Hi.
Yes.
Guys, really so much for coordinating this meeting. This is fantastic. Thank you. I'm Hilary Rothrock. I'm a home caregiver for my 28-year-old brother. He has Duchenne muscular dystrophy, and I take care of him along with our 70-year-old mom. It's actually, my mom is his grandmother and I am his aunt, and she adopted him. We don't have help from any family. We're both single moms. And we got the letter that they wanted to take away 42 hours a week from his care. And my mother still works full time. I'm trying to support 2 middle schoolers. So it would have been me that they were asking to work 42 hours a week for free. And I can't do that and support my family at the same time. Now my brother, he does need 24-hour care. He would be in a hospital. He would be in a nursing home if he was not home with us. And he's 28 years old. He has autism too. He wouldn't be able to manage being away from his family. So I feel like we keep being told that it's what he needs and not what we want. And need is very subjective. And the person that came out, we had an in-person assessment with UPMC. She came out, she was not familiar with his case. When we got the complete assessment from the assessment tool, so all the answers, she had put answers in that were completely false. Like she said he could use a telephone independently. He can't lift his fingers. He can't lift his arm. He can't move at all independently. So he can't do that. There were other things, but in the end they said, well, he must sleep sometime. And I hate to tell everybody, but people at the end of their lives do not sleep. They don't sleep well. He can't scratch an itch. He can't move his blanket. Last night, obviously because of the snow, we didn't have coverage, but because of the loss of hours in that period, we lost 2 full-time workers. And it's been over a month now. I've been working over 100 hours a week for the last 3 weeks, possibly more. But I don't even bill for all the hours that I already work for. I'm very careful and I was a crisis counselor. I've done case management, like I understand the systems. But at this point, it's just me. I'm homeschooling 2 middle schoolers. Trying to help my mom who's 70 and is struggling herself with her own medical conditions. I have my own medical conditions. And now we've lost 1/3 of our staff or 2/3 of our staff. We have 1 other person helping. And I just feel like, one, it was a mistake. The assessor, my mom and my brother went through the assessment and listed all of the mistakes put into that tool, and then to be told that he must sleep at some time so we don't need to be paid to take care of him has cost us a lot. It's been extremely
Yeah, Hilary, I can hear in your voice, and I think our hearts go out to you and your family for everything you're going through, and how challenging it is to be a caregiver, period, let alone with everything else you obviously have on your plate. I think you mentioned it was UPMC. I don't know if David could maybe chime in to respond to some of the issues that Hilary raised. I'm hoping, Hilary, you're connected with an advocate. CARIE tends to deal with older people, but there are resources that we could connect you to help, since you mentioned the participants 28 years old. But anyway, you can still contact us. We can try to help you get connected. But David, did you want to respond to Hilary's situation and how you might be able to help?
Certainly, and I also posted in the chat and asked Hilary to provide specific details with my email address specifically for Hilary, so she can contact me, so we can look into this in more detail. Generally speaking, our assessment process is to focus on kind of the assessed activity and independent activity of daily living needs, and we really want to focus on kind of what participants can do for themselves, or what other what assistance they might need through the waiver program, and then also look into what services may be available from informal supports. From what it sounds like, there may have been a kind of miscalculation in that process, and it's certainly something that we can look into, because again, we don't approach the assessment assuming that family members or individuals within the household are providing care for are expected to provide that care. It really is based on their availability, willingness, and ability to provide those services to support individuals. But the underlying assessment is supposed to focus on the specific needs of the individual, their activities of daily living or independent activities of daily living. And really just want to, if you can send me the details, we can look into this specifically and see what we can do to assist you.
Okay, thank you. I mean, I appreciate that. It's in the hearing though, they made the assumption that my mother and I were both married and had assistance, that there were 2 other caregivers in the home or people that could assist. And it was embarrassing to have to say that I'm getting divorced and I don't have assistance like that. And my mom has been separated for 20 years from my abusive dad. So to bring that up in the hearing was just, even more hurtful. I understand, but I do believe that between the assessment tool, there's something definitely wrong. And with that tool, if they're making all these cuts, saying that it's a need, but I think either the assessors aren't trained correctly, or the assessment tool is faulty in some way. Because I believe you, I believe what you're saying, but that's not how it's going out in reality.
And please, yeah, send the details and we can look into it. And I apologize for your experience with the appeal process. I know they're difficult under even normal circumstances, but I apologize for kind of the response that some of our folks may have had during that time period. So
thank you.
Please reach out to myself and we'll look into this specifically.
Okay, thank you.
Kathy, I just wanted to add real quickly. Oh, sorry,
Sure.
I think I'm on mute. Am I on mute?
We
Can you hear
hear
me?
you.
Okay, good. And I'm actually a little embarrassed to admit that I've been doing appeals for over 20 years now. So I think sometimes we, the health plan, and I have to remind people at the health plan, and sometimes I have to remind the advocates who are representing people who are involved in the grievance hearings, that the grievance hearings, they're supposed to be informal fact-finding proceedings. And I'm sorry if you felt put off or intimidated by it, because I know it does happen, but that's not what the process is designed for. I mean, if there's incorrect information in the assessment, that's your opportunity, should be your opportunity to share that with us so that we have the correct information. And you shouldn't feel intimidated, and you shouldn't have to explain why the information was incorrect, but just that it was incorrect. And I know it happens, and I try to correct it when I can, but I know sometimes we all need to be reminded that it's really supposed to be a informal fact-finding proceeding, and your opportunity to share with us why we got something wrong, and so that we can then have the additional information and update or adjust the decisions that we made.
I mean, yeah, I appreciate that. I feel like that's something that should happen before they say they're going to be cutting those hours, because if you could imagine someone telling you that you're going to have to do 42 hours of work a week and not be paid for it, or your family member is not going to get care for that 40 hours a week, it's a lot of pressure.
It is. Granted, I can't imagine, what you have to go through every day, and I certainly commend you for the work you do for our participants, for our members, and for your family members. But one good aspect about this process is that if you file your appeal within 10 days, nothing happens, no changes take place, and everything stays in place until the hearing process, the appeal process is resolved. And sometimes that can take up to 3 months to go through all the different appeals avenues that you have. So for those 3 months, there will be no changes, and everything would remain in place. So I know it's a little intimidating, but it does have some good features that really tries to allay some concerns, and will keep services in place unchanged if the appeal is filed within 10 days.
So thanks, Hilary, and we're getting near our time. And
Kathy, Hi, Kathy. Can I just add something? Yeah.
I'm going to get to you in a sec because I saw your comment in the chat. I will, Joe. But before we move on from this, I don't know if Norris or one of the other plans could comment. When someone feels, as Hilary illustrated, because we do hear this as well at CARIE, that there's inaccuracies from the assessment or reassessment. Is there anything short of having to go through the appeal that a participant can do beforehand? Is that something, Norris, I see you popped up. Can you just quickly comment on that?
At that really good question. And again, the assessment is designed to try to capture the needs of the participant. And sometimes we don't always get that right. Sometimes, and as you mentioned, Kathy, the telephone assessments aren't always, you can't see the participant when you do a telephone assessment. So there are things that you can see when you do an in-person assessment that you might not be able to see, or you obviously can't see when you do one over the phone. So you can always request a new assessment. If you're unhappy with the results of the assessment, you can always request a new assessment, and that would give an opportunity to capture the things that may have been missed during the original assessment. If you have an assessment over the telephone, you can request an in-person assessment, and that would, of course, give a better overview of the needs of the individual. And I don't think that we're actually doing in-person assessments right now because of the increase in the COVID-19 cases. So what that means is, until we're able to do an in-person assessment, that the benefits should stay in place. So a couple of things, and I know that the appeal isn't always the most optimal thing to do. But again, it really is designed to be an informal process and an opportunity to share additional facts, additional information that may not have been shared during the original assessment. And it's the safest and most effective way of making sure that there's no change to the services until the resolution of the appeal process.
Now, Hilary, if you can again, because I want to get to Joe before we wrap up. Hilary said she was told the reassessment would halt the appeal process. Can you clarify whether or not that's correct or incorrect?
Well, I mean, that's a good question. And it makes it a little tricky if you have a new assessment and there's an existing appeal. And there is an existing appeal, because if the appeal is filed within 10 days, we're not supposed to make any changes to the existing plan. So that does complicate things a little bit. You know, it's always best to try to talk to your service coordinator and talk to the health plan, just to make sure you're doing what makes the most sense. And you know, the health plan, we're required to provide someone to assist you in the appeal process. That's a requirement. So if you have questions about what makes the most sense, I mean, you can contact us, or you can contact one of the attorneys that provide free legal care that can advise you on what makes the most sense.
Thanks, Norris. Now, Joe, I think you put some important information into the chat around behavioral health.
Sure.
I'd like to quickly go, because I want to give every panelist an opportunity if they want to add any concluding remarks before we end the forum. But
Yeah,
thanks, Joe. Go ahead.
Yeah, this is my concluding remark too. Just sitting here, listening in on some of the challenges that individuals are having. You know, when you have extra stress added in your life and you're caring for a loved one or caring for a member, you know, you really need to take time for yourself too. So throughout COVID, the Philadelphia Department of Behavioral Health, we have a website called healthyminds.org. Our health care advocates there are able to provide resources for caregivers, frontline staff workers, just to help with loss, stress, grief, trauma throughout this. You know, the nursing facilities, we've sent out all these resources to frontline nursing facilities during the first wave of COVID because of the extreme loss they were working with. But even home healthcare staff, please take time for yourself. We have a lot of resources, you know, even though you can't, in these tough times, meeting people face to face, but we do have Zoom webinars and meetings. Just click on them. There's so many resources on that website. So please take care of yourselves, especially during this time. And you know, when you're healthy and you're more energized, you can help the members you're taking care of even better. So they're my final words for today. I want to thank you all for having me, and you know, get through the holiday season with peace and strength. Thanks.
Thanks, Joe. Those are very important words, and these are very difficult times. And please heed Joe's advice and don't hesitate to get that type of help. So now I'd just like to go through our panel and see if there's any final quick remarks you want to give. I guess, Jen, did you want to, or Kristen, I see you unmuting, so go ahead, Kristen.
Oh, sorry. I didn't mean to cut the line. I was just going to chime in and say that I really appreciate the discussion we've had today, and absolutely, you know, please access the resources that everyone's been making available. There are phone numbers and emails flying around in the chat for different people you can access depending on your concern. You know, at OLTL, we are constantly monitoring the program, and we do encourage you first to reach out to your managed care organization if you have an issue, because your case is always very specific to you and your circumstance, and your service coordinator has the best awareness of that and can get you in touch with the people at the MCO you need to speak with. However, that does not mean that OLTL is abandoning anyone. If you cannot get the support you need, we do still have the OLTL participant hotline, and you can call that at 1-800-757-5042. And I also put that in the chat. So again, please work with your managed care organization. But if you don't feel that you're getting the care you need, or you need additional support and you're not getting anywhere, or you don't feel that you're getting the response you need, please also reach out to the OLTL participant helpline. And thank you all for being willing to share your personal experiences and really illustrate your experience so far. Thank you.
Thanks, Kristen. Jen, did you want to give any final remarks?
I think just a thank you to you, Kathy, and your team for putting this together. I think we did a good job on Zoom. And I think that, you know, we're all in this together. We've been saying that since March, and I truly mean it. And I've seen some, a lot of really great things happen on behalf of participants, whether you're sitting on the advocate or provider side or the plan side or at OLTL through the pandemic. And I'm really proud to work in Pennsylvania in this plan and to strive to get better, and we're getting better together. And happy holidays to everybody, and stay safe. Thank you.
Thanks, Jen. David, oh, go ahead, Norris. I see you popped up, and then we'll go to David.
I just want to echo Jen's comments and thank you, Kathy and CARIE, for having this event and for having me today. I know Anna Keith usually attends this event, so you unfortunately got the B team today. So I hope you would consider inviting me back again. And just to say that I believe in this program. I mean, I've been around. I remember the concept paper from 2015, and I really think it's good for the people of Pennsylvania. And we're all striving to offer the best services that we can for our participants. And if there's anything that I can do or any assistance I can offer to anyone on the call today, just let Kathy know. She knows how to get in touch with me.
Thanks, Norris. David, did you want to go ahead? The floor is yours.
Certainly. Just want to reiterate my thanks for CARIE for hosting this event, as well as everybody for participating and asking very good questions and bringing up issues and highlighting things, and really encourage folks to continue to reach out to the managed care organizations. You know, I know they've been posted in the chat throughout the meeting. There are multiple ways to get in contact with us, but if you know, certainly communicate with us if there are issues or items that need clarification. And just again, thank everybody for being part of this discussion today and for highlighting some of the things that I know, you know, sounds like UPMC can do a little bit better in some regards as well. So thank you, everyone.
Thank you, David, and thanks again to all the panel and the participants. We'll be sure to send out a link to the event, and we'll compile the resources in the chat, so you'll have that in one document. I think Community HealthChoices serves the frailest people in Pennsylvania, and there's always challenges. We want to make this work. We're here at CARIE, and there's other advocates as well that work with the state, that work with the plans to get problems resolved. You don't have to do this yourself if you're not getting the results you need. Reach out and call. And I'll end on Joe's important comments, especially during COVID. The holidays often can be difficult for people. Be sure to connect with the mental health resources that are out there. Whether you call someone or need more intensive services, that help is there. And we can help get you connected to that too if you're not sure where to call. So thanks to everybody. I hope everyone has a safe and peaceful holiday and season and new year. And if the panel's willing, we'll plan something like this again next year, and we'll continue the conversation, because we all want to work together to make this work, this program and Community HealthChoices. We're committed to making it work for all. So thanks, everybody, and take care. Bye-bye.